everyone. My name is Kristina Markovic. I'm one of the registered dietitians here at New York City Health Hospitals, Queens. And happy Black History Month. This year's theme is Black Health Awareness, and I'll be talking about healthy eating within the Black community. So to start off, we do have to talk about factors that impact food choices, because it's not just about healthy eating, it is about your access to grocery store in your area. Let's say if your closest grocery store is 3 miles away, you need to take 2 buses to get there. You're probably not going to go as often. You're probably not going to be choosing as many fresh produce options. In terms of grocery stores, maybe the stock isn't that great. Let's say you do go often. You get there, the produce is moldy, it's going bad. That will impact your food choices. Social inequalities and access to health care, particularly specialists such as registered dietitians, also impacts healthy eating, because where are you getting your information from? Maybe friends or family. While they're well-intentioned, they may not have that evidence-based backing that we do. Social media is another place that we're getting nutrition information from. That may not be that accurate, may not be correct. So in terms of healthy eating, what is it? It's nourishment for your body. So you're trying to nourish your body, you're trying to fuel your body for the day. Give it enough energy, enough vitamins, enough minerals. How do we do that? We utilize multiple food groups. We're not just talking about one Caesar salad, dry salad every day for the rest of your life. That's boring and that's not healthy eating. We want to utilize multiple food groups so that we can get a variety of different vitamins and minerals. Food groups include vegetables and fruits. And again, this does not have to be that dry salad. It could be things that you grew up eating: spinach, collard greens, bell peppers, cauliflower, broccoli. In terms of fruit, not just apples and oranges, but things like papaya, mango, guava. So choose a variety of different ones that you're used to, not necessarily what you're seeing on Instagram or on Facebook. And throw out the perfectionist mentality. So you don't have to go for the fresh produce all the time and try to follow this recipe exactly. Do what works for you. If frozen fruits and vegetables or canned fruits and vegetables work for you, please choose those instead. Because having a perfectionist mentality of, I need to have fresh produce all the time, will lead to you not eating enough produce in general in the long run. Now, of course, all of our guidelines are based on a healthy person. So if you have any health conditions, remember, every body is different. Please speak with your healthcare provider. In terms of other food groups, we have grains. So most of the time, people think of things like rice or wheat, like bread, in terms of grains. But there are so many other grains out there, some that you may be more familiar with, things like teff, sorghum, wild rice. Another food group is grains. This includes things that we normally think of like rice and wheat, such as bread or pasta, but it also includes things like fonio, amaranth, buckwheat, and bulgur. So feel free to experiment with things that you may have grown up with. Another food group is proteins. So our proteins are found in things like meat or poultry, dairy products and fish, even plant-based proteins such as beans or lentils, nuts or seeds would also count towards your protein intake. The last food group I'm going to talk about is fats. Now, fats are typically found in our proteins that we typically eat, such as things like nuts or our meats, but there are other fats as well, such as things like coconut or avocado. You don't necessarily need to add additional fat in your diet. Now I'm going to talk to you about our guidance. We have the food groups. What do we do with them? How do we format them into healthy eating and a healthy plate? The guidance is called MyPlate, and it's made from the USDA, the U.S. Department of Agriculture, and you'll see here that half of the plate is filled with vegetables and fruit, with vegetables being a slightly larger section, and the second half of the plate is split between grains and protein, with your grains being a slightly larger portion. So how do we make this plate work for us? I have 2 examples here. This may be something that you typically eat or may not be. Here we have a vegetarian option. So this will be some lentils, edamame, and a lot of greens, chard, spinach, kale. This is going to be filled with protein, plant-based protein, of course. It's going to be filled with iron, potassium, magnesium. So this is a great option for people who are on the run or who like one-dish meals. So for example, if you don't want to be pouring out certain things like your grains and your protein all at once, you just want it all at once, there it is. Here we have another option, which is some lentils, some rice, and some vegetables. Again, you have every single portion, and this is both plant-based. So both of these are going to be great for our vegetarians or our vegans without an issue. If you wanted to alternate and eat meat some days, let's say if we were to do a Jamaican plate, for example, we would have our rice and peas. I can't mention Jamaica without mentioning my rice and peas. We would have maybe some chicken on the side and maybe some plantains or a different type of vegetable as well. At least half of your plate. Maybe on the side of either of these two plates or your plate at home, you'll include something like papaya, pineapple, mango, or guava to accompany your dish. So now we're going to talk about healthy swaps that you can make in order to eat healthier. First, if it wasn't already obvious, increase your intake of vegetables. Again, this can be frozen, fresh, or canned, depending on your body. In terms of vegetables, you can choose whichever ones you love, whichever ones you grew up with. Experiment sometimes. Eat the rainbow. Go for a variety of different colors in terms of your vegetables in order to get all the vitamins that vegetables have to offer. Another healthy swap is to replace good fats for bad fats. So for example, instead of using something like butter or lard in your cooking, try to opt for things like plant oils such as a canola oil or an olive oil. If you're using butter on something like bread, maybe you can swap to an avocado, which would be a bit of a healthier fat. That's what we mean by a good fat. In terms of another healthy swap you can make is trying to reduce added sugar in the diet. As a population, we are intaking way too much added sugar. So this can be as simple as your morning coffee. If you're currently adding 2 spoons of sugar into your coffee, bring it down to 1.5. Wait a few weeks, get accustomed to that, then bring it down to 1 spoon. If you're intaking something like soda, let's say you mix it with seltzer water. Start with just 1/4 of the glass of seltzer water and 3/4 of the glass of soda, and then maybe in a few weeks, you do half and half. Eventually, hopefully, you'll be drinking seltzer water in no time. Another healthy swap you can make is to reduce your alcohol intake. This often goes overlooked in terms of healthy eating, but even if you are eating healthy for the whole week, and then Friday, Saturday, and Sunday, maybe you drink more than you should, which is more than 1 alcoholic beverage for women or more than 2 alcoholic beverages for men. Another healthy swap you can make is reducing your alcohol intake. We often don't think about this in terms of healthy eating, but if you are eating healthfully throughout the week, and then Friday, Saturday, and Sunday, you're drinking more than you should, and more than you should means more than 1 alcoholic beverage for females or more than 2 alcoholic beverages for males, it's something to think about reducing for your own health. Remember, alcohol is a toxin. Now we're going to move on to how to implement healthy eating. So number 1, write down your motivation. Think of your motivation. It could be your friends, your family, you want to be around for a long time, or you just want to live easier. Write it down somewhere. What my patients like to do is they'll write down their motivation, they'll take a picture of it, and then they'll put it on their phone home screens, so they're always seeing it. Another alternative, you can put it on your door on the way out, so you always see that. Another way to implement healthy eating is to think of a goal. It's always good to have a year-long goal so you have time to accomplish that goal. Let's say an example of a goal for a year-long is I want to have MyPlate portion sizes for 5 out of the 7 days per week. That is a realistic, smart goal to have. Another option for implementing healthy eating is to remember to start small. Start where you're at. Don't start 5 different changes because that's not sustainable. Oftentimes, if we start multiple things at once, it's much easier to get those thrown out the window when something happens. It's always important to remember you have time to make all of these changes. Start small, like I had mentioned with the coffee and the sugar. If we're going from 2 spoons to 1.5, that's a small goal that's doable for you. Thank you all for listening. My name is Kristina Markovic. I'm one of the registered dietitians here at New York City Health and Hospitals, Queens. Take care.